Hello to all students. In this video lecture, we are going to discuss gall bladder stones, which are commonly known as gallstones, which is also known as cholelithiasis. It is a condition in which small pebble-like stones are formed inside the gallbladder, which can range in size from the size of a grain to the size of a golf ball. First of all, we are going to discuss briefly the important functions of the gallbladder. Gallbladder is a sac-like structure present beneath the right lobe of the liver in a shallow depression. Bile is produced from liver and is stored in gallbladder. Bile is a fluid which contains bile salts, cholesterol, fatty acid, and some other components along with water. This bile is secreted from gallbladder by contraction of the walls of the gallbladder through common bile duct into the first portion of small intestine, which is known as duodenum, where bile acts on fats present in the food and emulsifies them. Detergent action. After emulsification, fats converted into small globules or micelles. On these micelles and globules and particles of fats, lipid digesting enzyme like lipases can act easily on the food and fat is digested. In the absence of a bile, fats cannot be digested in our digestive system, which can cause complications in the digestive system and other problems of the gut. So, bile salts are very important, and bile is also very important for the digestion of the process. But somehow, for some reasons, in gallbladder, stones are formed. These stones are made up of cholesterol in most of the cases. 80% of the cases, gallstones are made up of cholesterols. These stones are usually yellow and green in color, while sometimes these stones can be made up of bilirubin, which is a pigment. This bilirubin is produced as a breakdown of red blood cells in the liver, and then this bilirubin is stored in the bile in the gallbladder. When this cholesterol and bilirubin is concentrated inside the gallbladder and it is precipitated into crystals, these crystals then turns into a sludge, and these sludge combine together, particles combine together to form a stone, which can be of different size. It can range from the size of a grain of a sand to the size of a golf ball. So there are different types of stones like 3 mm, 5 mm, 17 mm, 19 mm, 25 mm. So different stones, as you can see in this diagram, there are different stones formed inside the gallbladder. Usually these stones do not cause any trouble and they can move and pass from gallbladder into common bile duct into the small intestine, and along the feces they can be removed from the body. But problem starts when a larger stone stuck in the neck of the gallbladder and causing a severe pain in the abdomen. So that is the point where you have to go to an hospital emergency room or you have to see a doctor. So what are the symptoms during a gallbladder attack or gallbladder disease? The most common symptoms of gallbladder attack or disease are sudden pain in abdomen, especially on the epigastrium area on the right side of the belly, just underneath your ribs. This pain intensifies with the passage of time. There is also pain in the back between shoulder blades, and it can also intensify with the passage of time. There is a pain in the right shoulder, under the right shoulder, and sometimes pain can also radiate towards the neck. Nausea and vomiting is also a symptom in the severe gallbladder attack. Fever in case of inflammation or infection, and chills, sweating of the whole body is also a symptom of gallbladder. Yellow skin or yellowing of white of our eyes, which are the symptoms of increased bilirubin in our body, which can cause, which are the symptoms of jaundice. So these are the major symptoms which can also be confused with the infection of the pancreas or infection of the gut. So to diagnose the exact cause of these symptoms, doctor usually undergo some preliminary tests to diagnose exactly what is the cause of these symptoms. For diagnosis of gallbladder attack or gallstones, doctor usually perform blood tests which include liver function test and also some white blood cell tests to check the inflammation in the body and to check the enzymes of the liver, either they are normal or they are abnormal. Secondly, doctor perform an ultrasound of abdomen to diagnose the stones. If there are stones in the gallbladder, we can see that these stones in ultrasound. But sometimes doctors go one step further and do MRI. There is a special type of MRI test which is known as MRCP, which is known as magnetic resonance cholangiopancreatography. During this test, it is diagnosed that if the stones are still present in the gallbladder or they have moved from gallbladder into the common bile duct or they have been transferred to pancreatic duct, because pancreatic duct is also right just close to common bile duct and can block the passage of the pancreas. So to exactly know the position of the gallstone, these tests are performed. If these tests are positive, then it means that it is gallstones or presence of the gallstones in the gallbladder. So if the gallstones are present inside the gallbladder and they do not cause any kind of trouble, then there is nothing to worry about. But if the gallstone has been stuck in the neck of the gallbladder or it is causing pains, recurrent attacks of the gallbladder stones or recurrent attack of the gallbladder attack, then action should be taken. And in that condition, some patients can be treated by antibiotics with painkillers, and sometimes doctor has to remove the gallbladder from the body. So what are the causes of these gallstones? So first of all, doctors do not know exact cause of gallbladder stones, but most common causes of gallbladder stones are too much cholesterol in the bile. When liver is producing too much cholesterol and it is secreted into the bile, and when bile comes into the gallbladder for storage, right over here cholesterol precipitate into crystals and then helps in the formation of gallstones. The second cause is too much bilirubin in the bile. When too much bilirubins are present inside the bile, they can also lead to gallstones. The third cause is gallbladder does not empty all the way, because when we eat fatty food, usually gallbladder contract and the bile is secreted from gallbladder into the small intestine through common bile duct. But if the contraction is not powerful and the bile has been remained inside the gallbladder, which will be concentrated with the passage of time and crystal becomes crystals and turns into sludge, and this sludge turns into gallstones of different sizes. But these are the some causes which are identified by the doctors, but exact cause is still unknown. So once this gallbladder attack has been identified, then we have to go to treatment. So what are the treatment? Usually painkillers. If the gallbladder is not treated by painkillers, sometimes if there is a fever or inflammation or infection, then it can be treated by antibiotics. But the final decision by the doctor is to remove the gallbladder. So there are two methods of removal of gallbladder from your body. One is laparoscopic cholecystectomy. Cholecyst means gallbladder, tectomy means to cut out. In this condition, surgeon make 3 or 4 small holes in your belly, and with help of surgical instruments remove the gallbladder, cut the common bile duct and removes the gallbladder along with the stones outside the body. So in this way, bile produced from the liver directly poured into the duodenum. So in this way, the problem has been treated. But sometimes if the laparoscopic surgery is not possible, then surgeons do open cholecystectomy. In this condition, a larger cut is made in the belly and surgically gallbladder is removed from the abdomen. With some patients who have some medical issues like diabetes, heart issues, obesity, etc., these surgical procedures cannot be adopted. Then doctors advise them to do some different techniques to remove the gallbladder stone through endoscopy or some medications or by lithotripsy, during which stones are broken by short waves. So anyhow, there are different methods are adopted by surgeons or doctors depending upon the conditions of the patient to remove or treat the gallstones. But if the gallstones are not causing any problems, then there is nothing to worry about. But if they are causing pain and your lifestyle has been disturbed, then you have to undergo a surgery. And in the next video lecture, I will hopefully discuss the complications and the procedure of the gallbladder surgery in detail. That's all for today. Hopefully see you in the next lecture. Until then, bye.